Now, as medical professionals, it's very important to keep revising basics, when it comes to clinical topics. So, I thought let's go through gout today because, the patients are coming frequently, and what investigations to go for, and as a homeopath, how do you analyze the case and what remedies you can think of. So, gout is basically a disease of or a disorder of purine metabolism, and the byproduct of purine metabolism is actually uric acid. Now, what happens in gout? What is the situation that you can see in gout? There is excess of monosodium urate deposition. So these deposits are excess in gout. Okay. Now, the most common joint which is affected is grade 2 or the first metatarsal joint. What is the symptom? Obviously, you can see that this joint is inflamed. Inflammation characterized by redness, excessive tenderness. It's hot to touch. And you can also note that this condition is classically seen in males in age group 20 to 40 years of age, and the pain will be usually at night. Now, the other joints that you can see involved are ankle joint and knee joints. Now, besides the inflammation, you can also see excess uric acid in serum tests. You can see uric acid stone formation on x-rays. Patient can also end up having nephritis, and in soft tissues under the skin there will be tophi formation, which is again very painful condition. Now, what happens sometimes is you have to remember rise in uric acid in the serum of the patient may or may not have symptoms. So patient can be symptomless, but there can be rise in the uric acid. Now, what are the causes of gout? Basically, most of the times it's idiopathic. Okay, where it is usually associated, research has shown that under secretion of uric acid in the body can stimulate, over secretion. In cases of chronic renal failure, this can happen. Patients with hypothyroidism, patients with hyperparathyroidism can also have this condition. Patients who are taking diuretics and excess alcohol intake can also raise uric acid. This can also be a byproduct of, as a side effect of aspirin intake. Now, overproduction of uric acid can also be seen in other conditions like myeloproliferative disorders. You can also see this in many forms of leukemias and even in cases of psoriasis. So this can be an associated condition with these conditions. Now, what are the investigations that we have to think of? Now, the best initial investigation to go for is serum uric acid, which will obviously be raised. But how do you confirm? To confirm it, you have to go for aspiration of synovial fluid. Okay, what we can see on examination, there will be needle shaped crystals of uric acid seen, which are negatively birefringent. Okay, now sometimes abrupt decrease in uric acid can give rise to acute gout. A patient may suddenly land up with gout like symptoms. Besides these, if you go for ESR, that will be raised. If you go for TLC, again that will be raised. And if you are advising X-ray of the joint, whichever joint you want to go for, there will be punched out lesions with overhanging margins. Something like that you will see. Now we have to obviously think of the treatment plan. Now we can manage gout using some homeopathic remedies which work wonderfully. I would like to mention the names of the remedies, and then of course you can identify the symptoms according to the presentation and individually advise those remedies. Top remedies are Brynia, Leadimpal, Colchicum, Goecum, Formica rufa, Lithium carb, Calicab, Sticta pulmona, Berberis vulgaris, Chelidonium, Urtica urens, acid benzoic, and sepia. So I hope you like the video, and in upcoming videos I will be discussing all these important clinical presentations along with remedies which work wonderfully in homeopathy. Thank you so much.